Being a cancer nurse, you never expect who you're going to be taking care of next. In 2012, I was taking care of a family friend who just got diagnosed with a glioblastoma. I was at his house setting up his medications for him, making sure he's feeling well, not knowing with him what was going to be the next step, not realizing a year after that I'd be at the hospital myself with a glioblastoma. When I turned 29, I was so excited I have Haley and Landon. I was excited I had a boy and a girl. And to be honest with you, I was ready to go back to work. I worked three 12-hour shifts. I loved my job. I've loved Mayo. And that's what I was excited to come back to do. It was March 13th. I just got released to start running and exercising. We were running downtown with my father-in-law. We ran about 5.5 miles. I asked him to run a little bit longer, so we sprinted down and back. And then as soon as we stopped, immediately headaches, nauseous. So he sat me down on the sidewalk, brought me some water, and I sat down and literally, for the rest of that day, laid down, no food, throwing up, and headaches, the worst headaches ever. If you asked me, it was a 10, it was a 10 plus. When I found out I was sick, to be honest with you, I wasn't worried about myself. Obviously, I was worried about what kind of cancer it is because that was the first thing that came to mind. But I was worried about Haley and Landon the most. Because I was an RN already, I kind of knew about the cancer that I was going to have surgery on. The day before surgery, I was really, really nervous. I was worried about not waking up when surgery was over, worried about Haley and Landon. I was worried about Justin taking care of Haley and Landon by himself. I just assumed that it may not be a good outcome towards the end. When you think of a brain surgeon, initially you think of someone who just works on your brain, but they don't see the person underneath the surgery. Dr. Reimer sees me as me, not a brain cancer person, but someone he wants to take care of and make sure they can live as long as they want to. So he does the best that he can do to make sure my cancer doesn't come back. Every single person, that includes the nurses, the surgeons, the lab techs who were in the rooms, everyone was so sweet to me, took time to tell me what was going on, even if I didn't necessarily understand. I can't tell you enough how much I'm thankful for every single person at Mayo Clinic because they made my life even better than I would have thought it would have turned out to be. I've been doing awesome, but as of right now, I'm actually doing really, really well per the doctors. Dr. Reimer thinks my tumors, or no tumors at all, is in my brain. So as of right now, everything looks really, really good. When I was done with all my chemo, radiation, and everything, I felt normal again. My goals were to start running again. So the first goal I set for myself was to do the Donna run. I did that run. And then I also did the Gate River run. I've done that the last 2 years now. I couldn't have imagined 4 years ago now that I would be taking care of my children, taking them to school and games, spending time with my husband, going to work, running, doing all those things that I wasn't expected to do. Mayo Clinic has helped me be able to do all those things, and I'm very thankful for everything that everyone has done for me and helped with our family.